Basically, the Health and Social Care Inspectorate has identified a number of areas with serious shortcomings. Basically, the elderlies at these care homes, they were just not given individual assessments and individual care. 20% of patients never got an individual assessment. They just got the same treatment like everyone else. And those who actually did get to meet a doctor, a lot of them were just not meeting them in person. It was all done through distance. They also failed to inform the family, speak to the patients, and when they decided on palliative care, they just didn't follow protocol in terms of how many doctors that were supposed to be involved in such a decision of giving out morphine, for example. And as you mentioned, 6,500 deaths now, that's the latest figure, and almost half of those were older people in resident care homes. And I've met so many people like that over these last couple of months. One of them was Julia Gehem. She lost her uncle, Moses Intenga, and she begged them, to take him to hospital. They refused, and then he died. Take a listen.
He never got the chance to meet the doctor, and the doctor responsible of him said that he never met him, so all the decisions were made by telephone and not in person, so he couldn't see him and see the state that he was in. But on phone, the nurse said that, well, he's weak and he's got high fever, but we're taking care of him as well as we can. And we were wondering, but why can't he get that hospital care he needs? And they said that they were just following the orders that they get from the higher people.
So a lot of these families today, they feel ashamed. They feel like they should have done more. They could have done more when in fact they couldn't. That's what this report says today. And the Prime Minister has today said that this is very, very serious, what this report states.